Now I want to pass to Neil Johnson, Executive Director of the Global Heart Hub, who is going to talk to me about impressions of the first day of this Unite Summit. Neil, welcome back. What are your thoughts on what you've heard from day one?
Well, I've been furiously taking notes, and virtually every session could have been a whole afternoon in its own. I just think even just looking at the feedback online, we've had stellar presentations from stellar presenters. So very varied, as you know, and lots of different topics, some of which interrelated. But I think for patient organizations, a lot of food for thought, a lot of learning, and I'm glad that the sessions are recorded so people can have access to these again. I'm particularly reflecting back on the presentations, looking at my notes here. The first one on fundraising, again, while a lot of the concepts around major gift fundraising, I guess, was for something for the bigger organizations, and most of the patient organizations that are in our network, may have felt that that's all very well for the big organizations, but when you're down at grassroots, how difficult it is to be fundraising. But nonetheless, the key messages are the same. It's about friend raising, and there really are no shortcuts, and it's a hard graft. But if you truly, really make connections, money follows. I think that was one of the key messages there. And then moving on to the prevention presentations today. I mean, the data presented by Professor Gupta on the impact of hypertension, I mean, it's clearly a staggering concern, but the focus on decentralized, team-based care, multidisciplinary care, it's something that certainly we here in our own organization in Ireland are acutely aware of the importance of. I think it's quite staggering to hear that, less than 1 cent in the dollar is invested in cardiovascular health, which again highlights the need to have a political prioritization of cardiovascular health. And then, of course, Professor Wood's presentation really highlighted how COVID fanned the flames in cardiovascular disease, and how cardiovascular patients, or the people living with cardiovascular conditions, were most vulnerable, and therefore the urgency to invest in prevention couldn't be greater. And then, of course, we've had our session on mental health and cardiovascular disease, the hot topics. The takeaway for me from Michael Vallis's presentation is that we need to bring these patient beliefs into clinical exchange, because that's where the change happens in terms of getting patients to understand how to change their behavior and be compliant in their medications. I think, Sandra, your presentation today, and same with Marius, really is a glimpse into the future. I'm really, really interested to hear of the cardiovascular trigger research that's been done in Galway. I mean, at the end of the day, if we can predict, we can prevent. So I think the power of that is enormous. And then, Marius, you've been a leader of precision medicine in Europe, and yes, many may think that it's still a bit in the science fiction realm, but I think we're coming to the realization that this is coming down the tracks very quickly, which is great for patients, but we need patients to be informed, to be educated, and I guess that comes back to the role of patient organizations. Overall today, it's been a very broad range of topics. The feedback, as I say, online has been extremely positive. I hope people have got just one thing from today, which is what we're trying to achieve in this session. We have another full day tomorrow, same time, same channel. I want to thank you, Jackie, for a super moderation, and our last panel who are still with us, thank you for super presentations this afternoon. Back to you to say the final goodbyes.
Yeah, thanks a lot, Neil. Absolutely very well summarised. And as I agree, it's been a great day. 55 countries represented here. Lots of questions coming in. Fantastic. So I look forward to seeing the hashtags and the debate carrying on. Day 2 tomorrow, Central European time, 3 o'clock. We've got sessions on how patient groups can grow and professionalise. We've got lots of parallel focus sessions, and we've got how cardiovascular patient representatives can achieve political impact. So lots more to come and lots more in the resource on the platform. So don't forget to go to that. But I look forward to joining everyone tomorrow at 3 o'clock Central European time. Thanks for taking part and thanks for listening.